Hi, I'm Dan. On behalf of Nick and Dan for our anatomy project, we want to teach you how to do a two-handed tie. This one is for right-handers. So the first thing that you need to do is cross your right hand and your left hand. You're going to take the cord in your left hand and put it over your thumb. Put the other over, make a C, go through, and then push the cord through with your thumb. Pull it tight. Now over your left hand, over the first finger, make a C, pull it through with your index finger, and pull it tight. Then you go back to the first move, going through over the thumb, make a C, push it through, and pull it tight. Notice how the orange cord always stays in my left hand and the other always stays in my right. Also notice how there's a pattern emerging in the suture, the orange and the white, if you look down at the knots that I've tied. Next, if you're left-handed, the two-handed tie that you do is going to differ a little bit. Most notably, when you cross, you're going to put the white line in your right hand and start over your right thumb. You're still going to go over, make a C, push it through with your thumb, and pull it tight. Then you do the same. Over your right hand, first finger, make a C, push it through, and pull it tight. Then back to the thumb. Wrap it over, make a C, push it through, and pull it tight. Over your first finger, over, make a C, push it through, pull it back, and pull it tight. Often in an actual operation, you may not do a two-handed tie because you'll have surgical instruments that you can use to tie. Here we're going to teach you how to do an instrument tie. All right, to begin with, you can see that we've put a stitch through this cadaver's skin. I'm going to start by wrapping twice around my needle driver, grabbing the end, and pulling it through. Then I'll do it once, and then I'll do it again, starting on that side. Now you should notice that every time I pull the two lines opposite, and then I put the needle driver on the inside of the long line, and then grab the short end and pull it through. Now I'm going to make a mistake here in just a second, something that people commonly do when they're learning how to do this. I'm going to grab too short on the short end and get stuck. The way to get unstuck is to pull the short end through the knot. So the next thing that we'd like to do is show you how to close an abdominal skin incision using a running subcuticular stitch. A couple of notes as we get started. The first regards skin of cadavers. You'll notice sometimes we struggle to push the needle through cadaver skin. It's quite a bit tougher than the skin that you'll encounter in a real surgery. The other is that the instruments that we have in the operating room you'll find are better than the instruments that we'll be using today. So the good news in all of that is that what you do is actually going to be easier than what we show you today. All right, so first to get started, we're going to put a stitch in deep, and we're going to try and come out right at the apex. So watch the tip of my needle as it comes out. Then I'm going to pull it through. We start deep so that when we do our instrument tie, like we showed you in the previous video, the knot will be pulled down below the skin. That way it's not going to show when we're finished, which is what we want. Wrap it twice, pull it through, complete the instrument tie as explained before. After starting, we need to start running our stitch. So we take and we run in the edge, just right under the skin, into the tissue right beneath the skin, as close to the junction as we can get, a distance along the line, the plane of the body. Now we try and go straight across with our next stitch that'll be on the other side. Now you're going to start back further than you think you need to if this is going to look right. We go right in at that junction between the skin and the tissue right below it. We run a distance and we come out. You see how that's pulling closed? Now we're going to go to the other side, right at the junction of the skin and the tissue beneath, run a distance, pull it through. We're going to do this along the length of the whole incision until we reach the end, and we're going to cut to that part. While I'm finishing, two things that are worth mentioning. First, the longer each of your stitches is at the junction, the worse it's going to end up looking, but the faster it's going to go. By the same token, if you don't go straight across when you cross from one side to the other, then it's going to be crooked. All right, now we've done our last stitch, and we're going to bring our last stitch out at the apex of the incision, at the very edge, and we're going to leave a loop. We're not going to pull it all the way tight. Now I'm going to take this loop in my fingers, and I'm going to pull the end through to make another loop. And then I'm going to pull the end through to make another loop, and pull the end through to make another loop. This looks easy when you do it, but it's hard for your hands to figure it out until you try it a few times. So this is one that you're going to learn in practice. After pulling it through a few times, I'm going to put the suture through the loop itself and then pull it all tight. The reason I started deep is so that theoretically when I pull this tight, the knot will be buried. To help make sure that it's buried, once I've pulled it tight, I stick my needle in and I come out anywhere in the skin away from the incision, and I pull that tight, pulling that knot down under the skin. Then the last thing I have to do is just trim my line off right at the skin. All right, you'll notice as we're finishing up that the incision that we made is closed pretty nicely. We're going to cut this right off at the skin so that the line is not visible anymore. And we're done. All right, here I'm going to close another skin incision, but this time we're going to just let you watch and we're not going to narrate it. Okay, in this section, we're going to show you how to close a port side incision. There's more than one way to do this. You can do a running subcuticular stitch like we've done in previous videos, but in this particular video, we're going to show you how to do a simple interrupted stitch. All right, to start our instrument tie, we're first going to put a stitch in deep and then come out superficial, right in that border between the skin and the tissue right underneath it. And we want to come out right there or else it won't pull together well. So we go deep to superficial, and then on the other end, we're going to go straight across and then do superficial to deep. The reason that we begin and end deep is so that when we tie the knot, it'll be buried underneath the surface of the skin. So here we are going superficial, and then we're going to come out deep. You'll also notice that there's a single line going across, and both of my ends are coming out the same side. If the two ends of suture don't come out the same side of the incision, you're going to have a real problem. Pulling it together, and now I'm going to instrument tie as we've shown you in previous videos. All right, for your reference, right next to that first interrupted stitch, we're going to put another interrupted stitch, this time without narration.